It was the Facebook posting that was heard around the world. It was 3 years ago, and Sarah Palin put up a post saying Obamacare would ration health care and what she called death panels. Well, I happen to agree with her. They came after me, too. When I talked about rationing, I didn't say death panels. I said it was the Complete Lives system.
You got to look up the Complete Lives system and who in the administration is for the Complete Lives system. This is basically healthcare rationing.
It's amazing. That was the beginning of our network. The Obama administration and the media went on a rampage, and they blasted it and disputed it.
There is no death panel. There is no judgment based on societal productivity. There is no worthiness test.
I think there's a tremendous amount of disinformation that's out there. You all, the media, tend to cover X said this, Y said this, but some of you, but not everyone, does an investigation about whether what X said is actually true. Now, that's not a blanket statement. Not every one of you is that way.
We've called death panels false.
Right.
I don't know what more you want from us.
Well, I don't think everybody's called them false.
Some of people's concerns have grown out of bogus claims spread by those whose only agenda is to kill reform at any cost. The best example is the claim made not just by radio and cable talk show hosts, but by prominent politicians, that we plan to set up panels of bureaucrats with the power to kill off senior citizens. Now, such a charge would be laughable if it weren't so cynical and irresponsible. It is a lie, plain and simple.
Folks, no one in the government, nobody anywhere, no panel is going to sit down and tell your doctor anything about how to care for you, where we're all going to get to at that end of life period. It's malarkey.
This is absolutely unbelievable. 3 years later, a former Obama administration official, Stephen Ratner, writes an editorial in the New York Times leading with, quote, "We need death panels." He claims that too many Medicare resources are wasted on the elderly in their last years of life, and it's now time for rationing. I got news for you. Rationing is already here. It's happening with patients who are waiting for kidney transplants, and for some strange reason, nobody's talking about it. Dr. Dave Janda, he is an orthopedic surgeon from Michigan, and you've been following this and ringing this bell for quite some time. I guess I would be one of those radio or talk show hosts that the president was addressing in his State of the Union that said was making things up just to stop progress.
Well, you and Sarah Palin and myself.
Yeah.
In fact, Glenn, I've been trying to ring this bell for over 3.5 years, and you were the only one, and I'm not just saying this because I'm here, it's the truth, you were the only one in the media that allowed me to ring that bell. You see, Obamacare is really two parts. It's not just that health care bill that was passed in March of 2010. The first part of Obamacare was actually hidden in the stimulus bill. And that's where the big rationing board was, the Federal Coordinating Council for Comparative Effectiveness Research.
Say it again. Hang on just a second. I want to.
Yeah, it's a mouthful. It's a mouthful.
I want to get this right. The Federal Coordinating Council for Comparative Effectiveness Research. What's that?
That's a rationing board. Now, how do I know that? Because the definition of comparative effectiveness, that's in the title, is the approval or denial of a test or treatment solely based on two things: the cost of that test or treatment divided by, get this now, the number of years the patient will benefit from that test or treatment.
So it's not even effectiveness.
No, it has nothing to do with quality of care. And let's get that straight. Obamacare is not about creating more available, more affordable, more quality-oriented care. No. It's all about cutting costs, what I believe is the most unethical and inhumane means of cutting costs, something I fought my entire 30-year career in medicine about, and that's the rationing and denying of care. You see, that formula I just gave you is the same formula that they use in the British healthcare system.
Okay, so the death panels that the president said, I mean, it's pathological, the lying that was going on there.
I would completely 110% agree with you. I don't think it's incompetence. I think
it's called the Federal Coordinating Council for Comparative Effectiveness Research. It's in his own bill.
And listen, there's 16 members on that council, and they were all appointed by him. That was in the stimulus bill. It was passed into law in February of 2009.
Okay. So we also have Zeke Emanuel's complete live system, which if you can throw this chart up, explain, you get very little care very early in life, right, and starting around 60, you get very, very little care.
In the medical industry, we call this not the complete lives curve, but actually the Grim Reaper curve. And the reason is because according to the work Ezekiel Emanuel did, and if his last name sounds familiar, he happens to be the brother of Rahm Emanuel, right, the former chief of staff of Obamacare and mayor of Chicago, my former hometown. It shows that if prior to 15 years of age and after 40 years of age, it's questionable whether you're going to get treated because you're not seen as a productive member of society. Glenn, there's one word to describe that curve. Evil. And I'm just not throwing that. I mean it. It is truly evil. It is everything I have fought against in my career. The vast majority of folks in our profession of medicine have fought against. You know, when I became a physician in my first year in medical school 32 years ago at Northwestern University in Chicago, I raised my hand and I took an oath every provider has taken since 400 BC, the Hippocratic Oath. And that oath is about doing no harm. Glenn, that curve is all about harm. That curve is about people dying, and people dying needlessly.
Okay. When we come back, I want to take a quick break. When we come back, I want to talk a little bit about, remember, you look this up, the Federal Coordinating Council for Comparative Effectiveness Research. That's in the stimulus package. But beyond, hey, that's in there and maybe someday it'll kick in. It already is kicking in. I want to go over the New York Times article by Stephen Ratner and then tell you what's happening with kidneys. If you're on a kidney transplant list, good luck. Back in a second.